smart medical district planned for near West Side. The Illinois Medical District, IMD, is working with consultancy Ignite Cities to create the country's first smart medical district, using digital infrastructure to improve transportation, connectivity and safety on the near West Side. The plan is to leverage public and private partnerships to develop public Wi-Fi, digital kiosks, transportation and intelligent lighting, and other digital services to better connect people, devices, and services in the medical district, which serves about 50,000 patients per day. As more residents and visitors travel throughout the IMD for educational purposes, or to receive the life-saving medical care they need, we recognize our existing city infrastructure needs to evolve, said Suzette McKinney, CEO and Executive Director of the Illinois Medical District. Dignity Health posts quarterly loss. Dignity Health, which merged this month with Catholic Health Initiatives (CHI) to form Chicago-based Common Spirit Health, swung to an operating loss of $33 million in the fourth quarter of 2018, compared with an operating gain of $470 million a year earlier. Revenue dropped 18% to $3.4 billion, a decline management attributed to various factors, including lower patient and premium revenue. The San Francisco-based hospital chain also reported a net investment loss of $269 million for the quarter, compared with investment income of $119 million in the same quarter of 2017. Investment losses also marred the fourth quarter at merger partner CHI, Health Pulse reported on Wednesday. Newly formed Common Spirit Health now operates 700 sites of care across 21 states. Abbott in the news. The U.S. Department of Justice has joined a 6-year-old lawsuit accusing companies bought by North Chicago-based Abbott Laboratories of submitting false Medicare claims for unnecessary devices for diabetic patients and paying kickbacks to the patients. The lawsuit alleges Florida-based mail-order diabetic testing supply company Ireva Medical apparently required all new customers to receive free upgrades of glucometers and then submitted false claims to Medicare for medically unnecessary meters. Abbott didn't respond to a request for comment. Also this week, Abbott and Novo Nordisk entered into a non-exclusive partnership to combine Abbott's fast-growing Freestyle Libre system, which measures glucose levels through small sensors, with insulin dosing information from the Denmark pharmaceutical company's data-collecting pens. Abbott also introduced a rapid diagnostic test for hepatitis B, a serious liver condition affecting an estimated 257 million people worldwide, Abbott said. The Determine trademark HbSAg2 test, an easy-to-use point-of-care test, received a CE mark, making it commercial available in Europe, Africa, Asia-Pacific and Latin America. The test has also been submitted for World Health Organization pre-qualification. McHenry Hospital expands ICU. Northwestern Medicine McHenry Hospital is opening up 9 new private intensive care unit rooms, bringing the total to 27 beds. The hospital said nurses and doctors requested the change to better care for sicker patients. 9 cardiac telemetry beds were converted to critical care beds. An expanded ICU will help us provide more patients the close monitoring they need so they can recover and their families will have peace of mind, said Dr. Irfan Hafiz, Chief Medical Officer at Northwestern Medicine McHenry Hospital. The hospital also hopes that additional ICU beds will reduce wait times in its emergency department. 1/5 of rural hospitals near insolvency. A new study by Chicago-based consultancy Navigant shows 21% of the nation's 2045 rural hospitals are at a high risk of closing, Modern Healthcare reports. Inpatient admissions are falling as rural populations decline, leading to more bed vacancies and a rising number of patients covered by government-sponsored plans, factors that strain hospital finances and ultimately increase risk of closure, said Dr. Daniel DeBank, a Navigant managing director, co-author of the report and former CEO of the Omaha-based Nebraska Medicine System. As an indicator of whether these hospitals are necessary for healthcare delivery, Navigant set out to define Essential, based on factors including trauma status, proportion of Medicaid days or uncompensated care to net revenue, geographic isolation, and hospital employee to county population. Navigant deemed 277 of the 430 financially unstable hospitals essential to their communities. People on the move.